Hello, it's Tuesday night. I'm here and I've got some questions to answer. And if you have got any questions of your own, please do chip in and ask me here and now, because I'll be very happy indeed to answer said questions, because that's what I'm here for and that's what I'm going to do. So if you're wondering what's going on, that is what's going on. Okay, that right there is what's going on. Live Q&A with me, Jonathan Stoiano, plastic surgeon to the stars. I do this every Tuesday at 7 o'clock, if you're wondering. And if you want some scrolling graphics, that's what we're talking about. We're talking about commenting and sharing. So please feel free to comment and share. And since you're asking, this does become a podcast on iTunes, and we also chunk it up and put it on YouTube. So if you're an YouTube, if you're a podcast person, you get it on iTunes on podcast. And if you're, hold on, I've got a better one than that. There you go. I've got a YouTube channel, and we do different videos. The Stoiano Clinic is the name of YouTube channel, and this is one of the videos that goes on it, as well as other videos. So that'll be really good, because 203 subscribers. Happy with that. Very happy with that indeed. But you know, be nice to have 204. So if you're thinking of subscribing to my YouTube channel, you could be number 204. Yes, if you want to be number 204, get yourself over there, youtube.com/the Stoiano Clinic, I'm guessing. Is that how it works? I don't know. But anyway, I'm sure there's not that many Stoiano clinics on YouTube. So that is the, there you go. That's housekeeping. So this question, I feel bad about this first question, because this person asked me a question on Facebook last week, or at least before last week, and I said I'd answer it last week, and I didn't forget. I didn't cut and paste it across. I put it in the description, but I didn't cut and paste it across into the questions, so I didn't answer it. So I feel bad about that. So who knows? If hope she's out there and seeing this. So the question is, now if you want butt implant on your butt, what is the new way to do it then? So so basically, well, first thing I'd say is I'm not an expert in butts. I'm not a buttock expert. And if you do want your butt, there's not a nice way to say it really, is there? Bottom operated on, you probably, well, not probably, you are better seeing an expert. So I'm not really a man if you want your butt done, but nevertheless I can certainly talk about butts and the best way to do butts. So we start basically, the history was, we started with implants. So buttock implants, gluteal implants to be medical about it, and we put implants in the buttocks to enhance the buttocks. And there was a lot of problems with implants. The implants were, because it's obviously you're sitting on it all the time, they could migrate, they could move. There's people will often worry about where to put it in the breast. When you put implants, you put them in front of or behind the muscle. There's a sort of similar way of doing it in the buttock, where it would become intramuscular or submuscular. Intramuscular is quite bloody because you put it sort of within the muscle. Submuscular, people would worry because there's a sciatic nerve there, which is a massive nerve which supplies your leg, and you don't want to damage that nerve, because you need to be able to walk. So if you've got a so there was problems with the surgery. It's difficult surgery, potentially bloody. You get hematomas, you get infection. If you get an infection with the implant, you have to remove the implant. So lots of problems, potential with seromas. So it was fraught with difficulties, movement of the implants. So it was always a bit, one of those operations which was really a niche operation for only a few people who really embraced it. And then the natural history went. Then fat grafting became common in other types of plastic surgery, and fat grafting was really embraced by buttock implant people. Brazilian butt lift, BBL, all this sort of thing. Kim Kardashian, big butts, big bottoms or derrieres or whatever, and that's really sort of took off, and the fat grafting for the buttocks really took off and superseded implants. But then what happened was fat grafting. One of the things I always say to patients when I'm doing fat grafting personally, because I do a lot of fat grafting, but I never did fat grafting to the buttock because it was a different thing. When I do fat grafting, I do fat grafting to the breast, do very small volumes, bring very small aliquots of fat in, because each piece of fat has to be surrounded by vascularized tissue, and you've got to just put a tiny little injections of fat in so that it takes and it doesn't it gets a blood supply. People who are doing buttocks were putting large volume of fat transfer, significantly more volume fat transfers than we were doing in other parts of the body. And I've seen people talk, and I've seen people with great results doing this. And you think, crumbs, how are they managing that? Is that a huge volume of fat transfer? If we could do that at the breast, we'd be away. You know, we wouldn't have to use implants anymore because we could just do fat transfer. Because on paper, fat transfer is better than a million times better than implants. You don't have to no foreign body, no worries about the future in terms of infection or problems like that, or capsular contracture. So on paper, you thought this is great. Don't we often? This is hallelujah. But then what happened? Because there's a lot of big blood vessels around the buttocks, because there's huge muscles. They're called gluteal implants. The gluteal muscles, gluteus maximus, gluteus minimus, gluteus medius, they're huge muscles around your buttocks. If you look at a sort of anatomy specimen of a human, they're very big, strong muscles. Your buttock muscles are big, strong muscles, and they've got big blood vessels supplying them. And if you accidentally or inadvertently inject the fat into a blood vessel, then you get what's called an embolus. And an embolus is where tissue moves and gets into a blood vessel, and it can be fat or air or tissue that's not blood, basically. And that can fly around your body, and it basically gets stuck in your lungs, because your lungs, the blood vessels get very small where they sort of pick up oxygen. And if it gets stuck in your lungs, that's called a pulmonary embolus. And that, or in this case, a fat embolus, and that can be fatal. And people have died. Quite a lot of people have died having fat grafting to the buttocks because of this reason. There's a lot of big vessels, inadvertent injection of fat, so a big glob of fat into a blood vessel, into a big blood vessel, flies around the body, gets stuck in your lungs, and that will kill you. So it had a very high fatality rate, higher than any other type of cosmetic surgery, sort of legions away from any other sort of cosmetic surgery. And so recently it's fallen into sort of fallen out of favor, as you might imagine. Now, some surgeons are a bit annoyed at this because they're saying I'm doing it very safely and I've got a very safe way of doing it, and I make sure I don't get it into big blood vessels and things. As I say, it's nothing I've ever really done, so I can't really get into the conversation there whether that was a good decision or a bad decision. But I haven't told you what the decision is. Well, basically, BARPS, the Plastic Surgery Association in this country, said we shouldn't be doing fat grafting to the buttocks. They said if you're a BARPS plastic surgeon, you should not be doing this surgery until we've gone into it and looked into it and are happy that it's a safe procedure to do. So fat grafting for the buttocks is I won't say outlawed, but fully trained BARPS plastic surgeons have been advised not to do it. As I say, I haven't really got into the argument whether that's a fair argument or not, but on the face of it, when you look at the mortality associated with it, you can understand why they did it. And I do know surgeons who used to do it who are a bit annoyed. I don't know whether they can justify that their technique was much safer than the technique that the people who did it, who had the fatalities. But so now we're going back to implants, because fat grafting is out. So we're going back full circle to the implants that we went away from because we said they get infected and they move and they can be uncomfortable, and all the problems that we had associated with implants, we thought they were really bad. But now some people, and there are people out there, to be honest, not really much in the UK. It's not really big in the UK, but in other countries, certainly in America, in Brazil, in France, there's some very good surgeons who are getting good results with implants and saying that it's a safe procedure and it's good and we should all be doing it, and it's it's the same as breast implants and we should be doing it. Not the same as breast implants, but it's a sort of similar concept and we should all be embracing it and we should be doing more often. I've not really picked it up, to be honest, because it's not an area I'm familiar with. It is an area where there's a lot of very important structures, as I say, the sciatic nerve being probably the most notable one, which is the main nerve that supplies your the leg, the function of your leg. So, but the answer so what was the question? Now, if you want butt implants on your butt, what's the new way to do it? So I guess that's the new way to do it, but in fact it's the old way to do it, which was, superseded by fat transfer, but now fat transfer has gone out, so implants are back in. So short answer, it's implants. No, the question says if you want butt implant. Well, if you want butt implant, it's using a silicone implant rather than a fat, I guess, implant. So yeah, implants are, I guess, the new way of doing it, but you need to find someone who's does a lot of it, is experienced in it, which is not me, and that is what is the new way to do it, my friend. So that is it. Implants are back, but yeah, it's popular. I know it's celebrity pop. It's all over the place. We get loads of inquiries about it, but I'm a bit wary about it because I don't want to cause problems. So that's where I am on that one. That's where I am on buttocks. Right. So can someone have a tummy tuck if they have an ileostomy bag? Also, if someone has low mobility due to spina bifida, can they have lipo on their legs? I'm guessing this is the same person because I've only put tummy tuck with. So I'm just guessing. So low mobility due to spina bifida, can they have lipo on the legs? Absolutely no problem at all. Why? No issue with that. Lipo, I've probably said maybe I should have done a different. You know what? Maybe I should do it. That should be separate really, and I'll do this. Lipo. Should have done two separate questions, shouldn't I? Can you have lipo on the legs if you have low mobility? So absolutely yes, you can. So if you have if you have low mobility, you can have lipo on the legs. Lipo is really good for resistant areas of fat. So lipo isn't good if you sort of think your legs are too big. Or you're sort of overweight, or people who think, we have people who come and say, how much lipo can you do? How much can you remove? It's not really good in those situations. It's not really one that you can globally just liposuck the whole body and just make the whole body smaller. It's good for resistant areas. And certainly on the legs, there are certain areas which it responds well. The outer thighs, the hips, the so-called saddlebags, the love handles, these are areas where it does respond well. Not so much on the inner thighs. The inner thighs, the skin doesn't recoil quite so well. So there's certain areas which does respond well to liposuction, and it's really for areas for resistant areas of fat rather than sort of globally having large legs, I suppose. But certainly the fact that you've got low mobility and spina bifida is absolutely fine and no contraindication whatsoever. That's no problem with that. And then the second part of the question is, Roxana says hello. Hello, Roxana. Nice to see you here this evening. The second part of the question is, can someone have a tummy tuck if they have an ileostomy bag? So interesting question. And the answer is, it's difficult. The ileostomy is basically your bowel has been, your ileum, has been exteriorized out through your abdominal wall, and so you have a connection of your bowel to the abdominal wall. So the answer is that you'd have to be we would have to be very careful with it. And I wouldn't say it's an absolute contraindication. I wouldn't say it's a definite no, but I would say it's something that needs definite, careful consideration. We need to examine you. We need to see where that ileostomy is. If the ileostomy is quite low in your abdomen, obviously we wouldn't want to be messing with the ileostomy. We wouldn't really want to be sort of reciting that ileostomy. We probably want to really ideally leave the ileostomy where it is. So we'd be looking at taking the tissue below the ileostomy. Depends on how much tissue is there. If there's a lot of tissue there, and if you've got a significant apron, so if you look at the side view, if there's a big apron, big sort of hanging down, and the ileostomy is sort of above there, then we could do what's called an apronectomy, which is sort of like a tummy tuck, and sometimes people use the term interchangeably. But an apronectomy is more for someone who has got a significant abdominal apron, and you basically sort of amputate the apron. You just take off like a melon slice of tissue. You don't really do any undermining. You may or may not have the belly button in that apron, and sometimes you just say, look, the belly button's going to go. It's really for someone who's got a significant abdominal pannus, or a sort of overhang, and it's sort of less of a cosmetic operation, really. It's more of a functional operation of a significant pannus that's just sort of getting in the way, and difficult toileting, difficult with mobility and things like that. So that is sort of what I'm thinking, because you don't really want to be doing any extensive undermining, because you don't want to be undermining and then suddenly find the ileostomy there, and pericyth sort risk damaging that, because that could sort of damage bowel. So when we do a tummy tuck, we don't normally go anywhere near bowel, because we're sort of superficial to the abdominal wall, and all the bowel contents is normally deep to that. But when you have an ileostomy, it's sort of poking through. So we don't really want to see that. We don't really want to go anywhere near the ileostomy. So we would have to have a careful consideration. We'd have to examine you and make a judgment on that. And so I wouldn't like to say definitely yes. I wouldn't like to say definitely no. I'm sort of probably leaning more towards a no than a yes, to be honest with you, because you don't really, if you start damaging bowel, that can have significant consequences. But it depends on how much you're troubled by it, as to whether it's worth taking on the risk of surgery. And if you really are troubled by it and you want to consider surgery, it's something we could consider, assess, and examine you, and see if it would be possible to maybe take off, just a wedge of tissue, and close it up, and make you feel more comfortable, although it wouldn't be quite the same as a cosmetic tummy tuck. So if you look at photos of cosmetic tummy tucks, it might not be the same sort of result. So really, really reserved for people who have got, can you hear them in the background, have got a significant excess and a high ileostomy. So yeah, great question, that one. Good one. I haven't had that before. Not this. Here we go. This question. This is a patient who has booked in to see us, I think. So we haven't actually seen her yet. So I'm not entirely 100% sure what's going on here. Can a hole in the belly button be repaired and repierced? So on the face of that, I'm thinking, why? Not sure what's the why don't you just use it as a piercing? Maybe it's enlarged. I guess. Is that a problem? An enlarged belly button hole? Maybe that doesn't look good. So I'm sort of trying to work out what the issue is here. But on the face of it, the answer is yes. So first of all, sometimes people have belly button holes they don't like. So forget the re-pierced bit; they just don't like the hole. And it's just like when you get a piercing anywhere. If you get a piercing in your nose, in your ear, or anywhere in your body, people who get piercing in the cheek and things like that, you often get left with a hole where the piercing was, because the hole the piercing has made has epithelialized, skin has grown in it, and so it doesn't heal when the piercing comes out. Yes, you can repair it, and in terms of the belly button, you can just sort of excise that hole and repair it. It'll give you a little scar, it'll give you a little mark, but in the belly button, that usually settles really well. It's usually not a problem. So that's definitely possible. And then once that's healed, there's absolutely no reason why you can't get it re-pierced again. I mean, you'll have a little scar in the skin, so you'll have a new piercing sort of behind that scar. So you won't be having the same hole but smaller. You'll have a new hole, and the place where the old hole was would be maybe a little scar. But as I say, the belly button scars and things usually heal very well, especially if the scar's sort of on the inside bit of the belly button, so not on the front, if you know what I mean, of the abdomen. So yeah, that I think on face of it should be possible, although you have to see what you're after. But that's given the fact there will be a little scar there. So I've just got to warn you now. I should have a slide for this. I'm on the last question. So all in, fair warn. Get your questions in now if you want to get your question in, because this, my friend. Okay, this is the last question. So I should have done that as a scroller. Prefer the scroller. Okay. Last question. That's better, isn't it? Last question. So, if you have any questions, it's coming up. Okay. The last question is coming up. Are you ready for the last question? Oh, oh. Actually, I just remembered. I was supposed to look at some photos for the last question. Right. So I had an FDL. FDL is a fleur de lis, which is a sort of inverted T-shaped tummy tuck. So it's a tummy tuck where you get the normal tummy tuck scar and a scar also going vertically up the middle. And plus buttock lift, plus breast enlargement and lift. Blimey. I have sent some before and after pics of FDL, and my question is the amount of skin that left with acceptable? I feel like I might as well just have the extended TT and saved on scars if I'm still left with this skin. Oh, your opinion would be fantastic. Right. Okay. They did tell me you sent some photos, and I was supposed to look at them, and I haven't. Sorry. So I'm just going to have a quick. So, in principle, the thing about cosmetic surgery is the results are subjective. They are not objective. So they don't. Oh, I'm on. Just see myself on. Can I like myself? Can I like myself? Just like myself. Yeah. So they are not objective. It's not like. It's not like a surgery where you can have a result like a histology result or something like that says you've done a good job because you've removed all the cancer or something like that. They are subjective. It's the patient is the judge. So if you're putting breast implants in, I always say to people, look, if they think their breast implants are too big, they're too big. If they think they're too small, they're too small. It doesn't matter what I think. It doesn't matter what my colleagues would think or anyone else would think. If their patient is happy, then I'm happy. And oh, got it. And if the patient is unhappy, then I'm unhappy. So the mere fact that you're asking the question, you're asking me, is the amount of skin acceptable? Really, you're saying that you don't think this amount of skin is acceptable, basically. Here we go. We've got the photos here. There we go. Good. So, got the photos here. I have got the facility to show the photos on this. I haven't asked this question. I mean, I haven't asked this person if I can show her photos, because that would be good, wouldn't it? If I could show photos, then we should say to people, do you mind me showing the photos to the world? Anyway, so in a way, it's not a bad result. It's not a bad result at all, to be honest with you. It's a big deal. That inverted T has got a high risk of complications, and the main complication that you worry about when you do a fleur-de-lis tummy tuck is breakdown at that T junction. And and the breakdown is this. So you've got to be extra tight because you can get wound breakdown. Now, obviously, that's what happens to surgery. On my number 212. Can I check the sound on myself? Oh, I've gone off now. 212, 212, testing. 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 Is there sound? I should do something like saying, do something if there's sound. How should I do? How should I do this? Well, comment. That's it. Comment if there's sand. Not sand. Well, it doesn't matter that I said sand there. There's no say what I want. Oh God, Chloe can hear me. All right, I can't say what I want. Well, Chloe can hear me anyway. Khan, have you got sound? Should I just assume the sound's working? You're back my end. You're back my end? Okay, I'm back, so I must have gone. Did I go? I can hear you, but the picture is a little pixelated. You know, we've had that before, Roxana. I've had that in the clinic, and I'm having that now here. What is going? Just the last question lost the sound. Okay, so I'm back now. So, interesting question. Let me know if the sound goes off, if you can hear that. If you can't hear that, should I put it on? Anyway, let me know if the sound's on. Let me know if the sound goes off. So, bottom line is, if you are unhappy with the results of cosmetic surgery, it is a problem for the surgeon, because it's very hard for us to tell you you should be happy, you know, because we really want you to be happy. Actually, digressing, and I'm digressing because this is the last question. It's a bit like that non-surgical fat removing things. We've been having a lot of backwards and forwards with that, whether we should get one or not, because the results are really subtle. But there are, I think there are results with it. I did a blog post the other day. I think it does work. You know, it must work really when it's so popular. But they're subtle, and people pay a lot of money for it. We want people to be like really impressed with their results and really happy. If you have to convince a patient they've got a good result, it's never good. And it's a bit like in this case. To be honest with you, I think this is not a bad result. What I'm seeing here, this fleur-de-lis, I think it looks like it's healed well. You know, it's not a bad result. And it's always a bit of a problem when someone says, I've got a bit of excess tissue or a bit of excess skin or fullness, and you say, where is it? And they say, look at this, and they bend over and say, look, all this excess down here. Or push it together and say, oh, look at this, I've still got all this excess here. If you have to push it together to show the excess, if we took away that excess when you're not pushing it together, you might not be able to breathe normally. You know, you need to have a bit of give in your body. You know, if you can only show the excess when you bend forward, you know, everybody when they bend forwards has a bit of redundant skin there, because then they have to be able to straighten up. If you took that off, you wouldn't ever be able to straighten up. See what I mean? So there's always a bit of excess. So if you have to actually do something active to demonstrate the excess skin, if you have to sort of push it together or something like that, it's like, well, if we took that off, then you like that all the time, you might not, you know, sort of to a degree. I'm not saying 100%, to a degree. If it doesn't look too bad, and it doesn't look too bad. To be honest, looking at the photos, wish you could see it, there is a little bit of excess in the upper abdomen. Now, the problem with any tummy tuck, it doesn't really. Try to lip read. Not for me. Khan's off again. Khan's off. Hello. Hello. Oh, man. Oh, shall I push on? 212. 212. 212. 2121. Anyone? Right. It's hard there. I've got to think this through. How do I demonstrate? You may show my photos. Oh, I may. Oh, right. How do I? Well, I think I think I need to have entered it in a different way. I think I need to have put. I needed to have put them on before I'd started. Sorry. Sorry, Kaylee. I should have put. I haven't put them on. I've got them on up on another screen. I could show them on the other screen, couldn't I? Oh no. Sorry. Anyway. So yeah, but anytime you have to sort of pinch or demonstrate excess in that way, it's always a bit like, got to think about, well, if we, you know, when we got you on the operating table, you're lying on your back with your arms out, sort of crucifix. So you know, you make it tight in that position. And so when you're often when you first have it done, it's really tight, and then it gives skin naturally gives. So I would say, from a surgical point of view, I think you got an acceptable result. But you're obviously not happy, and from what I'm seeing, and it gets your body. From what I'm seeing is, can I hide all this stuff? From what I'm seeing, I am seeing. Anyway, I'm seeing a bit of X. I mean, it's a lot better than it was pre-op, and I'm seeing. Can it? Yeah. Well, I'm seeing a bit of excess in the upper abdomen. Is what I'm seeing, and I think that is always an issue with All right, let's go for it. Let's try and see what we can do here. So, so before, and then there's a bit of, I'm seeing, bit, oh God. See, there's a bit of excess in the upper abdomen here. Yeah. That was rubbish, wasn't it? That was that was rubbish. Sorry. Got all this software, you can do all this fancy stuff, but sorry, I should have put it on before. So that's what I'm seeing. The actual side to side where you've pinched it, which I didn't really demonstrate very well, is, you know, they probably could have made it a bit tighter, but I would be wary about doing a revision for on the side to side way. I think if anything, you need a bit of yes, I think lipo would help with the upper abdominal skin, the upper abdominal fullness, or reverse abdominoplasty is an extreme, but then you have like a H-shaped scar, which is pretty extreme. Reverse abdominoplasty gives you a scar underneath your breast in the same place as a breast reduction, or at least the same place that the horizontal scar of a breast reduction is, and it sort of joins in the middle. So that's a bit extreme to remove that upper abdominal fullness, if indeed it is the upper abdominal fullness that's bothering you, because when you pinch, you're looking like it is the actual side to side fullness that's bothering you. So I would say to you, a fleur-de-lis is a big deal, high risk of complications. You haven't had a complication, or at least you haven't had a surgical complication, although you have had a complication because you're unhappy with the result. But I think, I think it's a massive, massive improvement from before, and I think they've done a nice job. But it just is what the other thing I would say to you actually is that your skin is damaged. You can see the stretch marks. Stretch marks is basically means that your skin is damaged, and that means that skin has lost some of its elasticity. That's why you need a tummy tuck in the first place. The skin is damaged by being stretched. It doesn't loses its elasticity, and so it's hard to sort of give to get the skin really tight as a drum when you've got damaged skin with those stretch marks. You can see that there's residual stretch marks left behind following the tummy tuck. So I think it would be tough to make that significantly better. And I think there'd be a chance of wound healing problems if you had a revision where if they cut that out and tried to make it tighter. There's risks of wound healing issues, and it might just give to the same degree that it is now after a year or 2 years once the skin has had time to settle. So because there is sort of stretch marks there and the skin has been damaged. So I'll be wary about considering further surgery personally, and I do think that it is a nice result. And I'm sorry that it's not 100% in the bodysuit and what have you. But I think certainly when you're standing in that three-quarter view, the fullness in the upper part is something that I think might show in the bodysuit. I don't think the lateral fullness, the lateral thing that you're squeezing together, would show, and that might be helped by liposuction, as I always say, that doesn't take out skin, but then sometimes after a tummy tuck in the upper abdomen, you do need a bit of liposuction to fix that. It's not something you do at the time of a tummy tuck. It's not, so you commonly would do it after a tummy tuck, just to remove that upper abdominal fullness. So that is something that would possibly be an option. But I do think, broadly speaking, I'm going to say that's a nice result. I don't know if that's helpful or not helpful, but I do think you've got a good result there. It's a nice fleur-de-lis. So, how was that? That was it. Last question. Sorry, I didn't. You know what? Next time, you're very welcome, Kaylee. And next time, we'll ask people if we can show them their photos and stuff like that. So that is me. If you've got any questions, any burning plastic surgery / cosmetic surgery questions, please let me know. Kaylee's done a double thank you. That's what we like to see. 2 thank yous. Thank you, Kaylee, for asking the questions and for sending the photos. Very grateful to you. If anyone has any questions, please do what Kaylee did and get in touch, and I'll be very happy to. Oh, it's the wrong one. I don't know if there is a white one really. I'll be very happy to answer them. I will answer them every Tuesday, 7 o'clock here at Facebook Live. and I will be here again, same time, same place. And I'm sorry about the Khan. It seems to be only you with the audio. Sorry about the audio earlier. I think it, or maybe it was other people as well. Hope the audio sorted itself out. I'm not so pixelated now, and I will. It's because all the bandwidth I'm using. I'm using all the bandwidth. I will be back next week at 7 p.m. Have a nice dinner. Catch you then. Bye. End broadcast. I don't know when it ends. Does it end in